we have Ash Damle, who's an entrepreneur, and he has created multiple healthcare companies, invests in many of them. But a person who started off in the world of MIT in the US, in the harsh data science and computer ecosystem of their world famous media lab and AI lab. And I think Ash comes to us with a whole bunch of experiences of trying to put small components together, and now he's trying to see how he can connect some of them so they all make sense. So I think with no further ado, Ash, if you can take it away, please.
So first of all, thanks so much for the introduction. The only immediate response to the extraordinary conversations over the last hour and a half has been, wow, the work that has been done, the potential for impact is extraordinary. As mentioned, over the last 10 to 15 years, I've spent and built a variety of different companies to go ahead and move the needle forward. When we talk about how do we have clinical decision support, or how do we have AI help us understand what's going on, I founded a company called Lumiata, which is really about how do you bring modern AI to healthcare. And with that, we work with a variety of different health plans, ACOs, and other health systems across the country. Beyond that, I've helped start Medicare Advantage health plans here in California, and actually companies looking to replace PBM. So really having sort of a 360 view of how does actually health actually operate. And as we think about it, the overall notion was, how can we actually get health delivery to actually be lighter, faster, and much more sustainable than where it is today, right? I've seen that through Lumiata, we would identify what needs to happen to people, but how do you actually operationalize that was sort of the challenge. You would go to health plans, health systems, and that was always that last mile or last inch to be extraordinarily difficult. At the health plan, we actually stood up an entire other organization to actually help with that. Right. And so in a lot of ways, when we look at today, unfortunately, today's healthcare is still local and linear, right? In a very simple sense, a person goes through to get resolution. It could be days, weeks, months, right? In some senses, care is measured in those things instead of hours, minutes, and seconds, right? And so when we think about that, is that really the way we wish to experience healthcare? And I'm sure for all of us, and we've talked here multiple times today, that is not the case. And towards what people have said is, in some senses, we've now seen 10 years of innovation happen in literally 10 weeks. And so just look at what we're doing here today. We have people from Israel, UK, US, India, literally everywhere around the world coming together to think about how do we move forward. And in some senses, the view of healthcare, in my perspective, for tomorrow has to be global and matrix, right? Where it's not just trying to do things in serial sequential formats, but rather in parallel. So how is it when we're having a conversation with one physician, we can at the same time automatically pull in somebody, a specialist from anywhere around the world, such that in real time, as you need, it's 2 a.m. in the morning, how is it you can make sure you arrive at access to care that you need within 10 minutes or less? And really, it's not just about technology, it's also about operations. Like one of the things that I've learned is building technology companies, building, data first companies, AI first companies, et cetera, is that to actually make it a reality, you also have to think about the operations. So how can we rethink these types of operations from going from these sequential pipe models that we exist today to sort of platform models? We can see the things from everything from Uber and Lyft to, Open Door to otherwise, where when you go ahead and implement that, you just simply unlock the potential capacity that happens to be there and now make that available, right? So how do we go from long wait times to less than 10 minutes to start, right? How do we go from where it's just one person's opinion, to how do we have actually quality assurance baked into the processes so that we can actually ensure quality outcomes? How do we ensure consistent experiences, right? How do we actually go from having continuous increased cost to actually decreasing cost? And being able to make fast access to people who know what's there around the world, right? So when we've had a lot of conversation today, and obviously even the first day of this conference about the potentials of telemedicine, and obviously we're seeing an extraordinary aspect where there's a huge shift towards, in fact, remote consumption, right? That's going to be the new trend. It's the way it's going to be happening. And so when we go ahead and look at that, it's a great feature, it's an enabler, but it's not the basis for that new operating model, right? We have to think deeper. We have to think about how do we think about that core activity, right? And it's really about how do we go ahead, and we talked about this to some degree with people with data and other parts. How do we connect people to the right resource in the right time, in the, as soon as possible, right? And so when you think about that, if you have it as a bedrock, an AI managed market network, you can sort of enable a new type of operations, right? So it's how do I take the best of what's everywhere in the world, from people to AI and other things, and be able to make them accessible to an individual in that exact moment, is really a new operational model, right? And that's really sort of what we have to start thinking about, is how do we operate differently, right? Doing the same thing and looking for different, results is, insanity, as been quoted, right? And the core perspective of this is fast access really is key towards that high quality independent life, right? And so how do we go ahead and make that happen? And so with that notion, right, how do we support both providers as well as consumers, right? How do we help people access a global market? How do we enable someone who's in the middle of ER says, I really need, a particular HTM cardiologist? How do I click a button and talk to that person so I can get that input at that moment so I can make that right decision? How do I go ahead and have AI also support you in that exact process? How do I, from a logistical perspective of transportation or otherwise, how do I have help in making that happen, right? So, and then also just from a financial perspective, right? So how do we rethink the core operations so that we can really support people to deliver the best globally, right? And that also allows for people and systems to go and meet the consumer where they are expecting, right? It's an issue of how do I have that modern experience of being able to quickly access somebody? How do I get a broad access to services, right? Where I'm not trying to do the heavy lift as the patient, but rather the system is making it simple for me, right? So these are huge changes that are possible if you really start rethinking those core operations that happens to be going on. And so towards that, and as Sam said, I start a variety of companies, I do things, and if I look for a silver lining today, one of the core challenges that I had was, are people ready for that from a general consumer perspective? And we can clearly see that they are, right? And so towards that, how do we bring this to life? Because this is where I see that at the end, the core problem is we're trying to still ask a physician, a human being, to do more things in less time in a more complicated environment without providing the necessary support, right? So how do we really provide tomorrow's healthcare operations? How do we make sure it's fast, it's borderless, it's always on, available both as a simple click of a button in terms of an app, as well as being able to be accessible as an API so it can support other solutions and things of that nature. Because really what we're really trying to do is how do we provide freedom to people and to live that high quality life by being able to access to that comprehensive support care system in a very simple way. And so there's sort of three parts to as we think about it at Healiom as a global AI managed market network, which is really obviously the people. The supply also has to be varied. It's not just about providing GPs. It's how do you provide the spectrum of people and resources available, right? So your specialists, psychiatrists, pharmacists, right? People who are experts in reviewing particular data, right? How do we get them all to be able to apply themselves to people and data? We talked a lot about remote patient monitoring systems. We talked about real-time telemetry systems, and it's great that we're now arriving in the world of real-time care, but fundamentally real-time care or real-time data is wasted on part-time care, right? So how do we go ahead and arrive at a place where we sort of have that accessibility of service of Uber, that logistical efficiency of Amazon, that sort of intelligent processing, right? And it's sort of rethinking our core ops made possible by technology and AI to do that. And really, that's the core thing, right? We have to really think, is this the way we need to operate going forward? Or rather, do we need to actually take advantage of global resources, right? It's 2 a.m. in the morning, you have a congestive heart failure patient, their legs are hurting. Why aren't they able to ask someone right now? Yes, it's here, it's very hard, but in India, there's thousands, if not tens of thousands of people available to go ahead and connect with them. So this is sort of India's sort of opportunity where, in the past, as my folks came here, you would sort of import your potential people to go ahead and address the supply demand problems. Now with remote consumption is an ability to actually export that access and that extraordinary set of people to the world. And really this is all based upon these sort of notions, in simple way, divide and conquer, but basically how do you take each of the things that we're doing, but really deconstruct them and then basically map them to a number of different people around the world, get that work to be done, and then combine that, right? So there is this new opportunity with technology to support us to operate differently, which will allow us to sort of unlock the capacity that happens to be there, right? And this is really where, a lot of the other work that I've done and I've brought to bear here is how do you take advantage of literally over 80 million people's lives, looking at how does that connect, looking at physicians' work so that we can actually triage someone. So we've actually this has actually been used in real life, over 15,000 cases, right? Showing about how do I enable consumers themselves to identify potentially, the system, what's going on, connect that with the physician, dramatically improve the time that the physician has to spend to go ahead and provide that type of care, right? And to go ahead and accelerate that, as well as now combine that with adding quality assurance directly within that process so that you can actually really up level what's going on, right? So this is where you can sort of get the best of both worlds, where it's not just man, it's not just a machine, it's really about how do you combine the two. And that's really providing us the foundation to sit there and say, the world is making amazing things. And there are amazing people literally around the world. The question is, how do we coordinate all those things together so that we can deliver that simply to that individual in that moment to be transformative for their care, right? And this is really sort of the opportunity that we have in front of us. And towards that, it's beyond the access, right? Obviously, access is number one, but as the data we generate, the goal is to how do we support the next iteration of research and medicine. After looking at least in the US, over about 80 million people's worth of data, I've seen the good, the bad, the ugly. But the challenge is there, right? And so how do we support and provide that to researchers around the world so that we can actually become better and smarter every day? And then towards the next aspect, how do we train and support people from a resource capability? As we started today's conversation, there are people around the world in rural places, people are being trained. How do we support their training? How do we go ahead and provide greater resources to the world from an aspect of people? And it's actually just smart business, and it's actually about making health human. And towards that, in a general sense, would love to have people come and sign up and partner with us. We're looking to build a global network here that is really focused on providing that health support system that, as we sense from a perspective, is lighter than air, it's convenient, it's comprehensive, really connecting people to the best resources around the world, be they extraordinary physicians, extraordinary psychiatrists, social workers, but also to the next generation of AI that's coming. So with that, really wanted to open up for conversation. So please, looking forward to it.
Thank you, Ash. I think this was quite an interesting session. How do you effectively rewire the world so that it is anytime, anywhere, with anyone? So we can bring the best of ourselves, irrespective where we sit, what language we speak, what interoperability design we have followed to get to where we were. So I think if we could have some applause for Ash, and Ash, if you could stay on so that we could have some questions along with or just after the panel that we'll have with Anu. Some applause from all of us. I think quite an interesting view.
Thank you all. I'm looking forward to it. And as you said, it's about how do we get people access so they can get the care that they need. So thank you.